This is Dr. Devanshi Shah. I'm an eye plastic surgeon, and today we're going to discuss about droopy eyelids. What are droopy eyelids? Droopy eyelids, medically, it is known as ptosis. Droopy eyelids, when your one eye is smaller than the other, when your eyelid droops, we call it droopy eyelids. So when they both are drooping, we see both eyes are smaller. When one is drooping, you see asymmetry, which is very commonly picked up by the selfie camera. So droopy eyelids can affect anyone. It can be due to birth or it can be acquired. As I said, sometimes the patient comes and tells us one eye is smaller than the other. Or sometimes there is asymmetry. Or sometimes when they smile, that time the one eye looks smaller. Or sometimes they have this phase where your eyebrows are up. One eyebrow is down, up, one eyebrow is up. Because this muscle is compensating to lift the eye. So these are the common signs, the complaints or common symptoms we see. In kids, when the droopiness is since birth, there is something called lazy eye amblyopia. Okay, sometimes when the eye is covering the eyeball, sometimes the vision is not developed. That is what we call as amblyopia or lazy eyes. This has to be treated beforehand. Now, let me tell you, it's a very big classification, but one is acquired and one is congenital. Congenital is by birth. Babies are born with it, or sometimes it is acquired. Acquired, most common cause is age. Age, we call it aponeurotic ptosis. Due to aging, our skin and muscles weaken and our eye starts to droop. That is aponeurotic ptosis. Then there's something called neuromuscular ptosis. Neuromuscular in the sense our nerves or our muscle. So there's a LPS, levator palpebral superior muscle, which helps in lifting the eyes. If that muscle is affected, by trauma in the sense any fracture or any injury can cut the muscle and you can get droopiness. Sometimes condition called myasthenia gravis, where the neuromuscular nerve muscle connection is weak. We call it myasthenia gravis. It has to be diagnosed, and there also you can get droopiness. Sometimes palsies, any nerve palsies, any brain tumor or any body factors such as hypertension or diabetes can cause droopiness. Third nerve palsy. Third nerve palsy is a nerve which can be affected and cause droopiness. It is an acute cause. So there are a lot of causes of droopiness. Every cause has to be diagnosed and treated separately. If your eye is asymmetric, you need to go to an eye doctor. Oculoplastic surgeons are the one who commonly deal with all these conditions. So we first evaluate what is the etiology, what is the cause of droopiness, and then we treat it accordingly. So when you go to an ophthalmologist or an oculoplastic surgeon, they'll be checking everything. Whether your wrinkles are there on your forehead, what is the size of the eye, whether the grade is mild, moderate, severe, how much is the activity of the muscle, of the LPS muscle to lift the eyes. We sometimes do ice pack test. Ice pack test is a test where you put ice pack on your eyes for 5 minutes and whether see there is any improvement. We also take a detailed history, whether there's the droopiness is fluctuating throughout the day. In the morning, it is less, or in the morning, it is less. And once you work, it is more. Suddenly, you take a rest, the significance or the degree of droopiness reduces. So we evaluate all that together, and then we come to a diagnosis, whether what to be done. In kids, sometimes if there's congenital ptosis, there'll be associated squinting. Squinting is your eyes go in or out, or there will be associated lazy eye, as I mentioned, lazy eye amblyopia, where your one eye vision potential is less. So even if you wear glasses, the kids can't see clearly. Other thing which we look for is legophthalmos, when you close your eyes, whether eye is getting closed properly or no. There's something called jaw winking movement. Sometimes in kids with ptosis, what happens, they have abnormal movements also. Like when they're chewing or eating, the eye starts blinking. So we have to take and consider all these social, personal reasons why a person is affected for droopiness, and we have to treat them accordingly. Definitely you can fix a droopy eyelid. Whether you want to do it socially, cosmetically, or whether you want to do it functionally, that is what we surgeons look for it. Cosmetically, yes, you will get a very better result or a beautiful result. Functionally, very important in kids, again to avoid amblyopia. Sometimes the severity of ptosis is so much, it is covering the eyes. It is covering the pupil that your vision is affected. Like this is how I explain the patient. if you are not opening the shutter of your shop, you can't see. So our eyes are like eyelids are a shutter of your eyes. If your eyelids are not open completely, your vision will be affected. So we have to first decide whether what is the indication of the treatment, just cosmetic or whether it is affecting the vision or not. 80% of the treatment we do surgery. There are some conditions where we treat with medicine or some congenital ptosis, we give ptosis crutch glasses. Crutch glasses are those which have a support with our normal glasses, so they elevate the lid. But they are very rare indication which we do. Now, if we decide to go for surgery, where we think surgery is the best treatment for you, it doesn't affect the vision. We are not touching your eyeball. We are not touching your vision. We are just clinically touching your eyelid and the muscle around it. Sometimes, yes, we do get dryness after surgery. We do get some lid opening, like if your eye is not closing completely, and which causes dryness. So we need to treat the dryness with it, but we are not touching your vision. The vision is not affected by surgery.